We're entering our final series, our final 10 minutes together. So you're going to have your second to heaviest loop band around your outer thighs. And I'd like you to come over to a wall. Now, you're going to have your foam roller behind you for this, and you're going to use it for your lunges. Now, this is a rather challenging exercise. For some people, it's better to get a slider disc or a washcloth and put that under your back foot and just slide that back and forth because they tend to lose the foam roller. So the foam roller is behind your back foot and you're sliding back and forth in a lunge. And we're going back and forth, and we're obviously going to stay on one side because it's difficult to keep switching sides. So come to a wall bar or counter for safety's sake and hold on to it with one hand. Put the other hand on your hip. The band is around our outer thighs to help us find that hip distance and keep our abductors of the legs engaged. So I want the low abs pulled in, and I want you sliding back. It doesn't matter which side you begin with. Oftentimes I find that it's a little easier to start on with the leg forward on your dominant arm side because that leg is going to usually be more flexible, so you're going to go into that lunge a little easier. So keep that going. We're lunging. We're on one side. We either have a slider disc or the foam roller behind on top of our foot. Everybody's going to have to point their foot here just to keep that roller. I think flat back posture would benefit you more if you used the slider disc. That way you'll be able to dorsiflex your foot. That'll help combat that plantar flexion in your ankles. So flat back posture, I'm going to recommend losing the roller and staying with the slider disc or a wash rag. Continue where you are. And I'd like everybody to switch sides now, setting up on your second side. If you're feeling knee pain, just make sure you're using your low abs. I often notice when people are checking out with their midsection, all the weight of the body goes into the joints because you're sitting into it. So if you can actively use your breath and your lower pelvic floor, pulling the core in like you're going to be punched in your gut, sometimes you can make a staccato sound on your exhales for a while to find those abs, those lower abs, because they should be working to support you. Then you don't have to take the pressure in the joints. So keep going. We're on our second side. You're doing wonderful work. Slow tempo, slow down. Let's work slowly to build strength. We already raced through the day in a lot of other areas of our life. Let's take our time here. Exhale down. Inhale up. So that breath as you go back into the lunge slowly, you've got your ujjayi. As you come up, you have your inhale as your pelvis pulls down. Exhale back. Inhale up. And we exhale back. Inhale up. And this outside arm, if it feels better, you can take it up to shoulder flexion, palm facing in. Shoulder down the back. Make sure that chin's not falling forward. Where's your gaze? Make sure your gaze is just a hair higher than eye level. Pull the low belly in towards the spine. Hear that breath. 10 seconds to go. Remember how important the abs and breath are to keep your back safe and to also keep your joints safe. Bring it in. From here, second to heaviest loop band around our upper arms above the elbows. So actually, and we're going to then put the forearms on our foam roller, bringing our body against the wall, legs together, and we're going to hold a plank. So we've got the second to heaviest loop band above our elbows. We pull out on it. Forearms go onto the wall on the roller, and you walk your legs back, feet hip distance apart, and we hold this modified forearm plank against the wall. So holding this plank, breathing here. I want to hear those inhales and those exhales. So the closer the legs are together, sometimes the harder it is, the farther apart they are, and the farther you walk back, obviously, the harder it is. So keep your chin up, keep your abs braced. If you feel any back discomfort, bring it in or open the legs wider. Soft bend in the knees. Now play around with kind of rolling the arms up just an inch and down, engaging your upper back to do that. Inhale the arms up an inch, exhale them down. Inhale them up, exhale them down. Inhale up, exhale down. One more. Inhale up and exhale down. Great. Our final balance exercise. We're not going to need any equipment for this, just a wall, bar, or counter close by for safety purposes. So this is a great way to open up the hamstrings to test your low ab strength and your balance. We're all going to take our arms out to a T. We're going to step forward through space. So we're stepping forward and back in the sagittal plane. And as we step forward, we're going to sweep our leg forward and back. So it's going to go forward and back, sweeps, little sweeps of the leg, trying to stay lifted through our core, holding our arms out to the side. So we'll inhale, exhale, sweep, 2, 3, 4, pause, inhale, exhale, sweep, 2, 3, 4, and inhale, exhale, sweep, 2, 3, 4. Step forward on the leg that was sweeping, switch sides. Inhale, exhale, sweep, 2, 3, 4, and inhale, exhale, sweep, 2, 3, 4, inhale, one more, exhale, sweep, 2, 3, 4. Now the challenging part. Now make sure when you're sweeping that leg, it can be parallel, but it can also be turned out. And if you've had a hip replacement, you just want to watch out for turning the leg in. You don't want the leg crossing the line of the body. You're going to make sure that you're turning out the leg in the hip socket or keeping it parallel. So now we're stepping backwards through space. So you step back onto one leg and sweep that leg back. Immediately begin those sweeps. Inhale, exhale, sweep, 2, 3, 4, and inhale. Exhale, sweep, 2, 3, 4. One more, inhale. Exhale, sweep, 2, 3, 4. And last time, stepping back, flat back posture. You always have the option to flex your feet as you're working. Everybody else, point those toes. You want to send that energy through the legs. Inhale, exhale, sweep, 2, 3, 4, and inhale. Exhale, sweep, 2, 3, 4. One more time, inhale. Exhale, sweep, 2, 3, 4. Great. Final stretches. Come over to the wall. Bring your arm into a single arm cactus. So face the wall so your chest is basically on the wall. Arm is in a single arm cactus. And now twist away from this arm, pushing the forearm into the wall and then leaning forward and away from the arm. You'll notice a nice stretch in the upper shoulder, pec minor, may be intense. If it's intense, breathe. Don't push too hard into it. Just be where you are right now. Couple more breaths. Using those inhales and exhales. Let's switch sides slowly. Set up on the second side. Good. Bring one hand to your belly. Diaphragmatic breathing. Push your belly out here. Inhale, 2, 3, 4, 5. Let the belly fall back towards the spine. 2, 3, 4, 5. Inhale, push it out. 2, 3, 4, 5. Exhale, let it fall in. 2, 3, 4, 5. One more time. Push it out. 2, 3, 4, 5. Let it fall in. 2, 3, 4, 5. Great. From here, come to sit in your chair. We're going to close our eyes and do just a little relaxation to close our practice. So, option to bring your hands into this position where you interlace your fingers and you put your thumbs together, and you can rest the hands right on the thighs, plug the shoulders down. This opens up your throat chakra, allows you to speak your mind and be your authentic self. So let's close our eyes, and I want you to visualize a shade of blue that you associate with some sort of body of water where you've visited, vacation spot, a childhood memory, or perhaps a destination you long to go to. Put yourself in that blue water, and keep your eyes closed here. Take a deep inhale and exhale. Smell that air around you. Again, inhale. Look at that blue. And inhale. And exhale. Feel the water or the sand or the wind. And last breath, inhale. And exhale, let the eyes flutter open. You can always come back to this spot, come back to your breath whenever you're feeling overwhelmed. Great work.